Hey guys, welcome back to my channel. We're back with another rotation remedies. Today we're going to talk about how to do well in your OBGYN rotation. So let's get right into it. So in OBGYN, you're either going to find yourself on the floors or you're going to find yourself in the clinic. If you're on the floors, you're basically around to help deliver babies, to observe delivering babies, to deliver placentas, things like that. So I'll let you know what to do to get good evals in that situation. And then if you're in the clinic, then you're going to be helping out with gynecology. So you're going to be helping out with pap smears, you're going to be helping out with breast exams, and you're going to be getting experiences of doing them yourself. And in some cases, you might even get to observe colposcopies. So I'll let you know what to do to get good evals in that situation too. So what does a typical day in OBGYN look like? So if you're on the floors, you're basically just going to be waiting around. It's kind of unfortunate, but you're waiting around for women to come in and for women to give birth. Or you're going to be participating in surgeries and C-sections. And you'll have to divide up amongst the other students that you're with what procedure you're going to go to and who's going to cover what procedure, essentially. Depending on the hospital you're in, there may also be midwives, and those midwives will be going around checking on patients. If you're not in a surgery or you're not with a doctor, then follow one of the midwives and see what they do. If you're in the clinic, then you're going to be seeing patients throughout the day, one after the other after the other. Usually every patient will require a pap smear, and every patient will potentially require a breast exam depending on where they're at. Patients will have different questions about different types of situations that they're experiencing, or maybe about birth control or other medications. Patients may be coming in after giving birth to their babies, things like that. So what are we going to do to get good evaluations on our OBGYN rotation? So the first thing you got to do to get good evals is be on time. If you watched my video on delivering a baby, you would know that being on time is the most important thing. The next thing you're going to do to get good evals is make sure that you introduce yourself to every single patient on the floor waiting to give birth. Do not even think about attending any patient's birth if you did not introduce yourself to the mother first. Hell no, you cannot do that. When you're in the gynecology clinic, try to anticipate the needs of the doctor while they're doing pap smears. You want to get the lubricant ready for the speculum. You want to make sure the swabs are ready to get the specimen. Prepare the solution for the sample and use the tools that come with the sample kit in order to make the best test possible. Eventually, you will be given the opportunity to do a pap smear on your own. And if you want to get good evals, make sure that you act confident and communicate with your patient. This is a sensitive area, so make sure that you let them know what you're going to do as you're doing it. If you're going to touch them with your hand, let them know, you're going to feel my hand. If you're going to touch them with the speculum, let them know, okay, you're going to feel the speculum now. You're going to feel some pressure. These are words you have to use in order to get good evaluations and also to give good patient care. And of course, this is a surgical specialty, so you're going to want to follow the tips that I gave in my surgery video as well. I'll link that video down below. You want to read up on the procedure ahead of time and read up on the patient just in case you're going to get pimped. So think about the anatomy that you're going to be looking at, think about the technique of the surgery and possible post-surgical complication. Act like you're eager to participate in the surgery and make sure that you stay with your patient until they get to the PACU. Another thing you may get the opportunity to experience or do in the clinic is give HPV shots. Some patients, especially older patients, haven't had their HPV shot when they were a kid, so they need their shots now as an adult. And as medical students, that's one of the things that we get to do. You might get the opportunity to experience colposcopy clinic, which was my least favorite clinic. So a colposcopy is a type of test that tests cells on your cervix to determine if they are cancerous or not. So this is after you have a pap smear. It's an abnormal result on your pap smear, which indicates that you have abnormal cells on your cervix, which is worrisome because it may be a sign of cancer. Then you come in to get the colposcopy, and it's basically a clamp that takes a few samples of your cervix. We collect that sample in order to examine those cells. Sometimes if the cells are really abnormal, you can actually see a difference. They're going to be more white compared to the rest of the cervix, which is more pink. Sometimes you can't see any sort of difference at all. So you're just going to take a few bites around the circumference of the cervix and use that as your sample. The word bites is kind of aggressive, but it's exactly what it is. You go in with this long clamp that has like teeth on the end. You grab a little piece of the flesh of the cervix and just clamp down and take a piece. It's not the funnest thing. So now, how are we going to do well on our shelf exam? Well, the first thing that I would recommend for absolute sure is to do fetal heart tracing quizzes. So I did these quizzes. I had no idea what fetal heart tracings were when I did my OBGYN rotation, and I learned so much. Doing these quizzes really helped me to figure out if I'm looking at accelerations or decelerations, if my patient's baby is in danger or if everything is normal, if they're moving properly. So these are the types of things you need to practice, and the only way you're going to practice that is with these quizzes. There's a few questions like this on UWorld, but not that many. So if you want good practice, do these quizzes. I'll post the link here. The next thing you're going to do to get good grades on your shelf exam is those UWorld questions. And also those NBME exams, those are always going to be helpful. And the last tip I'm going to give you is memorize the difference between bacterial vaginosis, trichomoniasis, and vaginal candidiasis, because they all have discharge and it can be difficult to remember how to differentiate them. So make sure that you go over this over and over and over again, because there will be a lot of questions like this in UWorld and you want to be prepared. Okay guys, so I hope this was helpful. I hope you do great on your OBGYN rotation. If you follow these tips, I know you'll get good evals and you'll get good grades on your shelf exam. And I'll see you in the next video. Bye!